what we're not looking at is an expert with a neophyte relationship. This is not, expert telling ignorant person what to do. He's very clear that it's always a meeting of equals, and the yoga teacher or therapist may have more knowledge or learning of yoga tools because they have been studying yoga specifically for longer, but that does not give them any greater insight or knowledge or expertise when it comes to working with this individual. And in fact, the student that you are working with is the expert on them. They might not recognize that. And students often come and say, fix me, tell me what to do. But the job of the yoga therapist is to support that person to understand what they need and then to go and get that, whether that's through a practice or something that they have to do. And so it's a two-way relationship. It's not experts standing on a pedestal here and then the person coming in and saying, oh, help me, great master. That's not how it works. It's a meeting of equals. And this person maybe has a little bit more yoga learning, but this person has a boatload of stuff that they know as an equal human being. And they are consistently overlapping in each other's education. Because as a yoga therapist, I know nothing about you when you walk through the door. I have so much to learn from you, about myself as a yoga therapist, about the world, about a ton of stuff. And I have to acknowledge that and be open to consistently learning from you, or I am not going to be able to help you. I cannot share in your experience of life unless I am willing to learn from your experience of life. So that's super important. What Desikachar is talking about from a Western perspective, now I'm a qualified psychotherapist, and we would call that the therapeutic relationship. And there is a ton of evidence out there that shows that psychotherapy works, right? Psychotherapy, it really works. People have a problem in their life and they go and see a good trained psychotherapist and they do the work with that psychotherapist. And then at the end of the period of work, they are better. They either feel better or they are relieved of their symptoms, or things are just better. And there's a pretty high success rate with psychotherapy. But there is no consensus whatsoever on what type of yoga psychotherapy works. No consensus, and there is no evidence that shows that cognitive behavioral therapy is more effective than psychodynamic therapy, or that narrative therapy is more effective than person-centered therapy. So there are over 100 different types of therapy, right? And there are therapists who've trained in all of these, many different modalities. The evidence is that all of these modalities help people feel better. And so the evidence seems to suggest that what is actually solving people's problems is the therapeutic relationship. It is that relationship of trust, of positive, mutual, unconditional regard for one another. So unconditional positive regard, or positive unconditional regard, is a big person-centered term or person-centered psychotherapy term, is that it doesn't matter if the person in front of you is a saint, if you've got a Buddhist monk who's come to you for help, or if they're a murderer, or if they're a genius on the Einstein level, or there's somebody with cognitive disabilities or whatever. It doesn't matter where on the scale of human accomplishment or behavior they sit. You, as the therapist, extend to them the same unconditional positive regard as you would the next person. And it is from that unconditional positive regard that the therapeutic relationship is formed, and it is the therapeutic relationship that does the healing. So as a psychotherapist, I have studied a ton of different therapies. I might use a bit of narrative therapy with this student because that seems to work. They seem to like that. Somebody else doesn't want any of that. Imagine if you're a cucumber. How would the cucumber think about this situation? Which is kind of the crazy stuff you end up doing in narratives sometimes. Imagine you were the bird on the fence. How would the bird on the fence navigate this? They're like, I'm not having any of that nonsense. So you do cognitive behavioral therapy where you give them a very, list-based, no nonsense, straightforward practice. But in actual fact, it's not the CBT. That student is just more comfortable with the CBT. And it's not the narrative. That person just likes telling the stories that eases their problems and heals, or whatever it is, whatever the benefits are that they get from that. It is that therapeutic relationship that forms the foundations. And that therapeutic relationship requires trust, unconditional positive regard, reciprocity. That can be really hard with a student. And if you find that you cannot achieve that with a student, it's maybe time to refer that student on or go get some more training. But in the graduate certificate of yoga therapy, we learn basic counseling skills. They learn micro skills, micro counseling skills. They learn the active listening skills. They learn to do reflecting and mirroring. So this is not becoming a psychotherapist. We absolutely do not use psychotherapy techniques. But both Western empirical evidence, and there is a ton of it, and the Eastern tradition. So that was Desikachar in that video saying the same thing, but he uses a different vocabulary for it. What Eastern and Western tells us is that mutual, positive, healthy relationship between the therapist and the student or the client is the foundation for the healing. And that is absolutely the focus of what we do in yoga therapy. And then what technique you use, it's not that it doesn't matter whether you give them Paschimottanasana or Nadi Shodhana, because clearly one of those might be more helpful for their back pain than others, right? But you will know what is most useful for that student based on the quality of your relationship with them. And then they will trust you. You can trust that you are giving them the practice that is most beneficial to them, and they will receive the most benefit because they trust you, you know them, you deliver them a practice that is in their best interest and that has been decided on mutually. It's never me saying, I know what you need. I know what you need. Oh, I know what your problem is, right? That doesn't work. What works is, hey, I'm listening to you. I hear what you're saying. What do you feel? How is this for you? Maybe I'll suggest some chanting. How's that going for you? If that's not working for you, we'll do something else. So I am never the expert on your well-being. Any expertise on your well-being comes from you, but it's my job to help you discover that because you have it within you, but you're just not able to access it. And it's my job to support you to access that self-knowledge and that understanding and that learning that supports you to move towards healing, whatever that might look like. That was a long rant.